Oh, great. There we go. That's the issue. Maybe could everybody hear me? Okay. I'm gonna have to do that one more time. I forgot to hit go live. Thank you, Tiffany. See, the technical difficulties still keep going on here. But anyways, we've got our pediatric event. Everybody probably just missed all that pediatric stuff I was telling you about. One spot left for the pediatric event. So make sure that you get a chance to check that out. If you need help with the room block, let me know. Also, we've got our PI for All event coming up. That is in June, middle of June. Are you part of that, Cliff? We can't hear you there, buddy. I
No,
don't think we can hear
no, I'm not. I'm not. I was before though. It's a good event.
Oh, yeah, yeah, yeah. So that's another great location. That's going to be down in Huntington Beach. So if that's something that's of interest to you, make sure that you check out and scan the QR code here. Another great property. Not sure what we're looking like as far as attendees and room block yet, but we're a little over 2 months away from that one. So make sure you're checking that out. In addition to that, I would say those are all the announcements I guess we got for today, because I want to make sure that we get on with introducing our special guest today, Dr. Cliff Tao. How you doing?
Very good, Phil.
Oh,
Sorry, I
good.
was on mute. Very good.
Uh,
Thanks for having me.
of course. If any of you have interacted with Cliff, you'll know he's a great guy, super big supporter of the association. It's just nice to have someone like you know, kind of to be able to bounce things off of, you know, when it comes to radiology concerns, practice concerns. I just took one of your courses the other day, man, and you guys are doing such a great job on your site in terms of offering continuing education and just the case studies. I loved it. It was great. So I really
Oh,
appreciate
thanks.
that about you. And so I'm excited to bring you to the podcast and tell us a little bit about yourself, how you got here, your involvement, all that kind of stuff.
Oh, about myself. Well, I went to chiropractic school in Chicago at National, and the only reason why I went there is because all my friends were going there. I'm Canadian. I was born in Canada.
Okay.
My dad is, well, he's retired now, but he's a medical radiologist.
Hmm.
And so I think we kind of have the same brains. We like to analyze things up the wazoo,
Sure.
and we don't really like talking to people that much. uh, well, I like talking to people more than he does, but uh, and I liked out of college. I was in kinesiology in college because I liked the human body and kind of figuring out how the body works. I was into sports. I played varsity badminton. I know it doesn't sound like much, but it was pretty brutal. That's where a lot of my injuries come from. And so I'm like, and a lot of friends in my class were going to chiropractic school. And I didn't get into CMCC. A lot of us didn't get into CMCC, the Canadian school, but most of my friends went to National. And I didn't know anything about it. And so I just applied there and I got in. It was easier than getting into CMCC. And then
Yeah.
I couldn't go right away. I had to work for a couple of years. So that's how I ended up going there. And I didn't think I was going to do radiology just because it seemed so far fetched, but it kept, I don't know, chomping at my heels. I mean, this was back in the mid to late 90s. If you remember, there was no Facebook, but there were these email lists or listservs. Do you remember those?
Yeah. Yeah. Of course.
And so I was on a couple chiropractic ones even before I got into chiropractic school, and there was radiology ones. I'm like, wow, this is kind of interesting. And then I knew, my dad did radiology. I'm like, I wonder if it's just calling me, but it seemed too hard. Like, it seemed like too intellectual for me or
Yeah.
too academic, so I'm like, okay, whatever. But then when I went to chiropractic school, we had a really great DAC bar. His name was Todd Knudsen,
Hmm.
a real nice guy. And I met him, and he's like, and he said this to everybody. He said, hey, if you guys are interested, we have a free thing where every morning at 8 a.m. or so, they sit down and read all the clinic x-rays from the day before. And so you can come anytime. You don't have to register. You don't have to pay. I'm like, oh, that's my kind of thing. I don't have to pay. So I showed up once a week, for every week of chiropractic school, sometimes more, sometimes less. And I loved it. And that's how I started doing radiology. I couldn't get into national because they canned their program at the, or
Mm,
they didn't can it. They cut down their resident spot due to budget concerns. So that's how I ended up down here in
yeah,
at LECC, and I stayed down here. It's pretty nice down here. It's a little better than Chicago. It's a little better than than Canada, where I was from anyway. And yeah, I love it, Phil. I don't know if anyone else loves radiology more than I do, but it's so easy. I thought it was, I mean, it was hard, I think, but now I feel like it's so easy to do what I do. I mean,
that's awesome, man.
I love
One
it.
of the things I really enjoyed too about your stuff is you make it accessible, you make it real world, and it does you make it feel easy. So I appreciate that. But let's
Mm.
get into today's content just a little bit more. I want to talk about radiology errors and spotting what others miss. Because take us through that process and kind of your what you're looking for and what we should be looking for and all those kind of things.
Oh yeah, sure, Phil. This has been a topic of interest for me personally for years, decades, I would say, and so I would read stuff myself on how to make myself better, how to minimize errors on that I do, and I never thought anyone would be interested, in until someone mentioned something, and I'm like, oh yeah, I can definitely put something together. I just wasn't sure if anyone liked it. So I think people like it. I don't know if it's because they like. Well, let me back up a little bit. I feel like as radiologists, DAC bars especially, we're kind of trained to be right all the time,
Mm,
and I came out of the residency thinking I could do no wrong. Um, and it took me a while to figure it out that wasn't true. But I think some radiologists, maybe some DACBARs, are still like that, and it took me a lot to kind of figure out why I was making these mistakes and how I can communicate that better.
sure,
And that's the other thing. It was very difficult for me. Maybe this is true for all radiologists. It's difficult for us to communicate. One, generally speaking, and then even to our own colleagues,
mm,
chiropractors. We're supposed to speak the same language, but it was very hard for me. And we trained in the medical model in the DACBAR residency. We had to learn
right,
all that stuff. I mean, we kind of flip flop back and forth between chiros, medical chiro. Um, but the medical component was very strong. And so, I had to kind of fine tune the way I communicate and how I talk to my colleagues, my friends, chiropractors. And so uh just to say that I haven't always been like this. It's been a work in progress. I think I'm still am a work in progress. But one
aren't we
thing
all?
that going back into the errors thing is that I think one thing is that we just need to be more mindful. I think we get used to being in practice. We're busy. We see lots of people. We see lots of X-rays, and most of the X-rays are okay, right?
Right,
They're normal, or there's some degenerative disease or something. And I think we just get used to this pattern, right? Oh, it's happened 10 times, 20 times. I haven't seen anything, and then when there is something there, if it's obvious, then we see it. But sometimes it's not so obvious,
yeah,
or it's not in the spine, right? That's what we're looking at. And even though it's only a couple inches over, we'll miss it because just not in our habit. It's not in our
right,
routine. And so my thing is, we have to have this more comprehensive mindset when looking at X-rays. And for me, and I think for most, if not all, DAC bars, we're trained to look at everything, and we want to find stuff that normal people wouldn't find.
right,
That makes us feel better. Most of the time it's probably not relevant, but sometimes it is, and it can impact our patient's health. So I think, I mean, I don't, everyone doesn't have to be a radiologist, but I think you can, as a chiropractor, you can borrow some of our mindset and have a more kind of comprehensive approach to looking at X-rays. Don't get caught by those. Sometimes we call them corner shots,
sure,
right? Location dependent findings, and one way. Well, so then the question is, how do I do that day in, day out without taking too much time,
Sure.
without having someone to, beat down on me. Cause that's, that's how we learned is someone beat down on us, Phil,
Right.
physically, mentally, emotionally for 3 years. And now it's kind of hardwired in there. And so one thing I like to do is, we got to come up with something really easy. So I came up with this saying, look again and keep looking. So keep
All right.
looking means, just because you find one thing, that doesn't mean your job is over. You want to make sure there isn't something else there, even if you think that one thing is what you're looking for. And so that's what keep looking means. And then look again means we should be looking twice at our X-rays. And I mean, there's some nuances to it. So the first time you look at an X-ray, I think you should look at them, and this is how we were trained as well. We're only looking at the image. You kind of forget about what I'll call non-imaging data.
Right.
So even the patient's face, forget about what they look like. Forget about what all your assessment or analysis revealed. Just look at the picture and come up with what you think is on the picture, the X-rays. And then you kind of reinsert that stuff back in your head. Why are they here? Who referred them?
Mm.
Where's their pain? And then you look at it again, and you shouldn't see anything else, but sometimes you will. And at least I think you'll reprioritize what the findings are that you saw, and make it more relevant for you, and more relevant for your patients. So those are the two kind of quick things I like to kind of, yeah, advertise, so to speak. And I think that if you just keep in mind those two things, look again, and keep looking, I think we can do a better job. It will take a little extra time, I'll say. So I know time isn't always on our side, but I mean, I can, in my presentation, I kind of go into a lot more, but time, we really do need time to, treat our patients right, I think. And part of that is looking at the x-rays. We do need time to look
Well,
at
I
them
love
and
the
make.
idea of kind of personalizing it, like you said, and thinking about the case history and the case management and who sent them in. That's a take home for me, because I can see the applicability of that. But so I appreciate that. Can you kind of give me like, because I know we got some new graduates on here and we've got new some students as well and that kind of thing. Like, give me a couple of steps. Like, when you first look at an X-ray, are you looking straight at the bone? You looking straight at the soft tissue? Like, what's your quick 5 to 10 minute scan that you can advise us to do? I mean, other than sending stuff to you to review, which at this point in my career, sometimes I'm like, I'm just going to send it to Cliff or to somebody. It's much easier that way than And I still would like to look. I use X-rays all the time to look at areas of subluxation, look for misalignments. How am I going to adjust this person? What technique should I be using? Is there contraindications? All of those kind of things. So I'm a big advocate of X-ray and reviewing and utilizing my X-rays. But if I'm new or just getting started in this business, what's a 5 to 10 minute kind of process that I can go through to make sure I'm dotting my I's and crossing my T's?
Well, one thing I like to say, that's an important question, Phil, because we all have different ways of doing things, even amongst us staff bars. You think we're pretty tight knit as a group, but we all have different ways of even just looking at X-rays. And one way to make sure we get everything, at least on that first look, when I talked about looking at things two times, on that first look, I think you should have a checklist. And I think we all learned in school, right? The ABCs, A for alignment, B for bone, C for cartilage or joint spaces, and S for soft tissues. And so that'll kind of force us to look at things that we don't normally look at, right? How often do we look at soft tissues? Very rarely, because we rarely see anything on there. And it's known, right? X-ray doesn't show soft tissues very well, but most tumors and bad things are soft tissue related. So we just want to make sure we at least scan it, and we can say, okay, they look okay. So that's the first thing, is have a checklist, and you can use the ABCs. There's other ones out there, and ABCs only work for bone X-rays. So if you're looking at other stuff like chest X-rays, there's a, I think it's actually A through, uh, not Z, but I think it's A through G or H or something. So there's a lot more things to look on a chest X-ray. You can use that for chest X-rays, and there's like another one for MRI of the spine. There's another one for CT of the spine. So having a checklist is, I think, is good to at least on that first look. And then, when you look at it again, you know, try to look at it more focused on, where the patient's problem is. You detected based on your palpation or whatever you're scanning, whatever you're using, that there was a subluxation at L3. Oh, so you want to look at L3 more carefully and make sure there's nothing weird going on there that might give you an illusion that there's a subluxation, like there's a block vertebra there or something, for example. And so having both views, I think, is good. Both views or both looks. One kind of more comprehensive and one more focused. And having that checklist, I think, would really help.
Excellent. Hopefully, we didn't lose everybody too much. I was, I had an internet connection problem there. I think everybody was able to still keep hearing you talk. So
Oh,
that was good. They'll give us some feedback if we weren't, I guess. I'm sure.
I thought you just wanted to see my face bigger. I mean, my face ended up being on my screen. I'm like, oh, I was gonna say something, but I'm glad you're back, Phil.
I do that sometimes just to highlight the speaker, but it looks like you only lost me, which isn't a big deal because I'm not as important here in this whole process today as you are.
Yeah,
So I'll have to
you're pretty
rewatch.
important too.
I'll
We're
have
all
to
important.
rewatch the recording to get those little tidbits. So, but no, I appreciate that. Well, talk to me too about one of the things. Like I said, I've always appreciated how accessible you've made it in terms of the reading process and just interacting with the X-rays and that type of thing. Talk to me a little bit about the role that you can play, or help people understand the role that you can play in their clinical practice and that kind of thing, because I think that can't be underscored enough, in terms of utilizing a radiologist like yourself in different aspects, PI cases, all of those kind of things. So,
Sure. Thanks, Phil. Well, I do have this kind of overall. It's not a policy, but I do feel like all X-rays should have a professional read them, and uh, I feel like DAC bars are the best professionals for reading chiropractic X-rays. And I emphasize DAC bars. I'm a DAC bar, but you could use any DAC bar. You don't have to use me. Use whoever you're comfortable with. But there's been a few studies even to say that we get things more correct than other radiologists. I know
sure.
it sounds like I'm tooting my own horn, but
I'm
I think
with you
it's
though, man.
true.
I've seen that firsthand. Sorry to interrupt you, but I've seen that firsthand in practice, sending or getting things from radiology centers and things like that. I'll call them up and say, well, what about this, related to this chiropractic case? And they're like, oh, yeah, we don't really deal with that a lot, or so it's not on our radar. So, but
It's insane, Phil. So I do this presentation on radiology. I know I'm diverging a little bit, but there's this one study I look at on why we make these mistakes in radiology. And in this study, they had people, radiologists, look at chest CT scans.
right.
We don't look at very often, but I think everyone's familiar with them. But a chest CT it's a big exam, or maybe you've had it done yourself. And if you ever look at it, it's like anywhere from 100 to sometimes 200 to 300 images of the chest. And in this research study where they tried to, make things, more relevant and more real life, everyone looked at each CT scan. Each radiologist looked at each CT scan for only 5 minutes. That's 200 images in 5 minutes. That's not a
Yeah.
lot of time
No.
per image. And I can't help but think, and they do mention this too, that you should not be doing things in a hurry. Oh, look at that, Dr. Pedro Pronto from Portugal is here. Hi, Dr.
Ooh,
Pronto.
all right.
Look at that, international.
We're going international, man. I love it.
Yeah, awesome. See, that's why I'm like, we got to get CE approved for on our other meeting the other day.
All
CE
right.
approved for other states. But anyway, what was I saying?
Just about how, radiologists read so many things. And
Oh
you
yeah.
said that on your class the other day too. And that kind of blew my mind. I was like, holy smokes, man, they're going through a lot of images, right?
Yeah, yeah. So it's I used to say that medical radiologists are half blind or they don't care, but it's a bad system, right? It's a
Mhm.
bad system. We have Kaiser. Everyone knows what Kaiser is. Kaiser is a terrible system within a bad system.
Yeah.
I have a friend, Phil, a personal friend of mine. He's a radiologist at Kaiser, and so we'll have lunch every once in a while. He's actually come to my house, my office, where I am now, and to kind of see what I do. And I ask him, his name's Young. I'm like, hey, Young, how many? So there's days where he reads MRIs, CTs, but there's days where he just looks at X-rays.
Right.
And I'm like, hey, on those X-ray days, how many X-ray studies do you have to look at? He's like, oh, well, first of all, he's like, well, do you mean a 8-hour shift or 12-hour shift? I'm like, well, 8-hour shift because we don't do 12-hour shifts in chiropractic. Okay, so he's like 8 hours, 200, like 200 studies. And so my biggest day, Phil, where I read the most X-rays, and it was very uncomfortable for me because I knew I was missing things. I probably shouldn't say that, but now I have a better system where I don't have to read that many.
Right.
But my top day, I did 70.
Yeah.
So he's doing 3 times as many, and you know what? Those aren't just normal X-rays they're reading. These are from the hospital.
Right.
So these people are bedridden. Complicated studies with lots of things. Think about probably 80% of them are Medicare patients. Uh, and not only that, Phil, most of these have prior studies that they have to look at too. So they
Okay.
have to compare with the prior ones. And I don't know if you knew this, but they don't get paid extra for looking at the prior studies and comparing. It's ridiculous.
Hmm.
Um, anyway, so
It's a
all
challenging
that to say
system.
that you do need a little more time, I think, to do things right. It doesn't have to be that much time, but I think it's time well used to look at X-rays or whatever imaging a little bit better.
Well, you don't have to convince me, man. I definitely have seen the value in utilizing DAC bars like yourself, and that kind of thing. So, um, I wanted you to just tell people how they connect with you if they want to utilize your service, all that kind of stuff. Tell people how they get a hold of you and that kind of thing, and or become a customer because I think, you know, you if you're on here, especially new graduates and things like that, utilizing somebody like Cliff in your corner is a no-brainer because that's a cost that you can pass on to the patients, as a reading fee. Sometimes people have insurance coverage for reading fees. You can just build it into the cost of your x-rays, that kind of thing. And to have the ability to bounce things off of someone like Cliff can really help you when you're just getting started.
Yeah, so I kind of pride myself on being reachable. I'm pretty sure there's not that many Cliff Towers around, so you could just Google Cliff Tow, and I think you'll get a hold of me. But yeah, my email, I check it all the time. Facebook, LinkedIn. I'm not super familiar with Instagram, but I am on there. But if you message me on there, uh, I'll reply to you. Within a couple hours. You can call me if you really want to.
We're streaming to Instagram right now, so maybe this will help
Oh,
you
we
in the
are.
algorithm. Yeah.
Oh, wow. Okay.
Tell people a little bit about your case studies and your website because I don't think that that's well known enough. And then we always try to post stuff on our social media channels on each of our individual. All of the districts have their own little Facebook group. We do have the Cal Cairo main page. So if you're not linked into Cal Cairo's Facebook page, make sure you're checking out that California Chiropractic Association. It's the one with about 2,000 members. There's like this knockoff one going on that I still don't think we've figured out how to get rid of.
There
But that's the
is?
main, yeah, that's the main page that everything gets posted to. Ideally, all of our district leaders and our district presidents are sharing the content from the main California Chiropractic page to each of the individual district group pages. But I know you post in there sometimes. So tell people about that and those kind of things.
Oh, yeah. So this is not meant to take away from CCA CE program. There's a lot of good content on there. I think I have a couple courses on the
You do.
CCACE website too. Uh, but my colleague Matt Skalski, is another dark bar, and we kind of train together at the same time. He's in Wisconsin now, but we do a live webinar every month, and where we kind of just go through various chiropractic cases. Sometimes he does a lot of presentations in the medical radiology field. So this last uh, time, I don't know if that's when you were on, Phil, on Tuesday, he was getting ready to present for Radiopedia, which
Yeah.
is maybe even the world's largest radiology conference. But anyway, he was halfway done his presentation, and he wanted to kind of give it a run through. So he did that. And it was on anatomic variants. But most of the time, it's just a kind of somewhat informal, casual conversation between him and I, looking at x-rays, what do you do in this case? What do you do in that case? What do you do when you see this? Stuff like that. So, and you get CE credit in California, a few other states too, but mostly we have California guys that log in. So we have that, and then we record them, and we have a website where we put in, there's I think 20 or 25 of our recorded webinars on there. So if you don't want to hear us live, you can go there and do it on your own time and speed through it. That's what I do. Put it on 1.5.
It's excellent though, and I keep going back to new graduates and students, that because I'm always passionate about helping new graduates be successful, and that's really one of the things we're trying to do as an association, to set you up for success. But I think you should be tuning into those. If you are, right now, if you're not seeing patients, you're waiting for licensure, like, you should be making that part of your daily habits. This isn't a time to rest. This is a time to research, get to work, plan, build, get ready for that next chapter in your life when it's all systems go and you're taking care of people. So it's a great opportunity, I think, for people to get connected with you, stay connected with you, learn a lot, and that kind of thing. So I really appreciate that. I think that's such a service to the chiropractic profession.
I'm glad to do it. Anything I can do to help my colleagues and elevate our profession a little bit.
And you truly mean that, man. I sincerely, I feel that all the time. So, well, let's we want to try to give away some money. I appreciate you being on the call today. We'll definitely have to do it again, and I'll have you, on one of the main stages, and continue to immerse. Cliff's always at our events too. So if you're looking for advice, don't be afraid to hit him up and tap him on the shoulder and say, hey, how do we connect? Kind of thing. So
Yeah,
thanks again so
sure.
much for being here. But let's try to give away some money today.
All right.
So it looks like, what's that, bud?
I said, all right. Hey, can I win too?
You can. Yeah. It's a completely, I could win technically, but I've always said that if I win, I'll just give the money to the political action committee, just so we can keep going to events and representing the profession, and trying to get these politicians to treat us fairly, but we could talk more about that in another day. Oh, there's the political action committee. I appreciate that, Tiffany. Thank you so much. All right, well, let's bring up the wheel and spin some names. We're going to spin 4 names today. So remember, to win the money, you have to be on the broadcast. Your name has to be drawn at random here by our customized randomizer. Shout out to my friend Matt Musgrave. You can check out his site as well, that built this for us, and super cool randomizer. Got some music behind it, and then you have to respond in the chat. Now, because I had these internet problems, I cannot see the chat feature today. So
you can't. Yeah, there's a bunch of stuff going on.
Is there? Oh man, I'm so bummed. I love seeing all the activity in the chat. Thanks everybody for being here today in the chat and interacting. If you get a chance to like and subscribe to our channel, I appreciate it, because that really helps us from an algorithm standpoint. And it makes you, if you can set your notifications and alerts, you'll get some information about when we go live, so that even if you want to just tune in here at the end for the money, at least you can be here to try to win some money for yourself. So, all right. Oh my gosh, Howie Chang, new practitioner board member, Howie Chang, you have won $400. Let's see if you're on the broadcast here today. I didn't text Howie to be on the broadcast. He should be getting the notifications. Hopefully everybody got our text messages today regarding the live stream broadcast. If you didn't get a text message, make sure you reach out to Tiffany, our membership director, and that we have your cell phone number on file, because that is how you will ensure that you get our text messages. A lot of people have their office numbers or their home numbers and things like that. So it's problematic. They're not getting the text messages because they haven't given us their cell phone number. I will wait to hear from Tiffany in the private chat if Howie said anything in the YouTube chat that he was here, but I am definitely going to be reaching out to Howie if he wasn't here today and he won the money. Oh man, that's too rich, too rich. So no Howie. So let's do name number 2. Otra Alver. I don't know Otra. You are our second winner today. Let's see if you're here to claim your prize. I always feel like even if you're not here to claim your prize, you're still a winner in someone's mind, right? It's just a matter of whether you're willing to let the universe gift you that $400, right? So hopefully Otra is with us today. I can't see anything in the chat. I'll wait. We're down to 1 second here. We'll wait just a few more seconds to have Tiffany let me know if Otra was in the chat.
Hey,
that way, what's that,
Phil,
Cliff?
I think Dr. Howie just logged on, but I think he's too late.
Too late. Yep, too late. Howie, somebody must have texted him and tried to hit him up saying he was here. Oh, that's so good. That's what happens, folks. You got to be on here. I guess number 3. Tiffany rolled name number 3. Amari Johnson, you are named number 3. Before you roll the next number, the final number, if Amari's not here, let me know, Tiffany, before you roll the one. I won't interrupt your randomizing, but Amari, you are named number 3. Let's see if you're here to claim your money. Howie, you should have to give $400 to the pack just because your name got drawn and you weren't here to collect it. So I'll make sure that I reach out to you personally, Howie, to see if we can get that $400 out of you for the Political Action Committee. Now that you're hitting the ground running and making all that money over there. If you guys haven't connected with Howie, you should, especially if you're a new graduate or a new practitioner. Howie is crushing it in terms of building his own practice. I think he's less than a year out. And this guy, you should see his social media and what he's doing. He's a rock star. So that's why I wanted him here on our board. And
I've seen it.
Yeah, he's doing some great stuff. But it doesn't look like Amari's here. So let's do name. Ron Rudometkin. Man, that was a mouthful right there. Ron Rudometkin, you are named number 4. Let's see if you're here to claim your prize today. Cliff, it was so great to talk to you, man. I always appreciate getting to know you better and learning more from you all the time. And like I said, I just took that course a couple of weeks ago, and it was one of those things where I was like, man, I gotta watch more of his stuff. I just felt like it was so accessible, so interactive. The conversational tone, learning about medical radiology versus chiropractic radiology, that was really of value to me. So I appreciate you for doing that. And doesn't look like Ron is here today to collect his prize, which I know everybody in the broadcast is happy about, because next week that means we'll be up to $500. So now we're starting.
Wow.
That's a half a rack almost right there. If you're like me and you like to go to the casino and play some cards or dice or whatever, right? That you could do some damage with a half a rack, maybe in Tahoe or Reno, but Vegas, we got to get up to a full rack. So, all right, let's log off, or we'll sign off for today. Thank you guys so much for being with us. Looking forward to seeing you next week. Connect with Cliff, and appreciate your time.